Singapore has seen an early uptick in influenza cases since late August, months ahead of the typical seasonal surge between December and March. Now, according to data from the Communicable Diseases Agency, this year's peak in cases is around 20 percentage points higher than last year's. And some doctors are seeing around 10% more influenza patients at their clinics. Nadine Yeam has more.
The Northern Hemisphere flu season is back, but earlier than expected. Data compiled by the Communicable Diseases Agency, or CDA, have shown an influx of patients with influenza, or H3N2, since the last week of August. The proportion of those who tested positive during that week, week 35, was 30%. It's been on the rise ever since, peaking at 40% in week 39, or the second last week of September. And there seems no signs of slowing down. One doctor says his clinic has seen a more than 10% increase in patients, all with influenza-like symptoms.
Actually, this current strain, we find that they are actually presenting more with fever and upper airway symptoms. The cough-wise, they are not very severe, and patients actually respond better and recover faster when they are started on the Tamiflu.
Doctors tell CNA many factors could have resulted in the surge: increasing international travel, climate change, or a lack of exposure to present circulating strains. Some doctors liken the local H3N2 strain to the one in Malaysia, where about 6,000 students were infected and schools were closed for safety. But despite early infections here, experts say Singapore is not experiencing a pandemic strain, and the island state has multiple lines of defense to deal with it.
We do have a few surveillance measures that is built into the woodwork of the primary healthcare system to make sure this thing doesn't really spread to far more greater proportions. And as a new sort of a wave for influenza sweeps through the population, eventually more and more people will get immune, and the outbreak will eventually die off because there'll be less and less people who have not caught it to spread it on.
Doctors advise practicing good hygiene, such as washing hands frequently and covering one's mouth and nose when coughing or sneezing. People are also advised to get their annual flu vaccines. The surge is expected to subside by the end of the year.